Good morning, friends. Welcome back to my YouTube channel, Medical Classes by Srinidhi Kumar. Don't forget to subscribe my channel and also give your valuable comments. And the students who are watching this video, they can also suggest some topic of their interest that I can discuss for you. Thank you very much. So today we will have another topic for discussion, that is a general understanding of Kaumarbhritya. So today we'll have one topic, so which will give a general idea of Ayurveda pediatrics or Kaumarbhritya. What are the specialties of Kaumarbhritya, and what are all the unique features of Kaumarbhritya among the 8 branches of Ayurveda? And again, the why Kaumarbhritya is very important, scope and importance of Kaumarbhritya. So we will have such some common understanding, and we will discuss all those matters. So we know that among the 8 branches of Ayurveda, Kaumarbhritya is also one, whereas Kashyapa considered Kaumarbhritya as the first branch, and Devanam iva Havyapaha. So just like Agni Devata, who is very important among the Devatas, Kaumarbhritya is also the first important branch of Ayurveda. Whereas if you see Charaka and Sushruta, so Charaka gives the 6th position, Sushruta gives the 5th position. And in Vagbhata, so Kaya Bala Grahar Dwanga, when he says, so he has given the 2nd position among the 8 branches of Ayurveda. Now, definitions of Ayurveda, I have already posted one important class about definitions of Kaumarbhritya, and we know that Charaka has given not a clear-cut definition of Kaumarbhritya. Rather, he has mentioned Bala. Okay, Tatra Balam Nama Aparipakpadatu Ajata Vinjanam Akleshasaha Sukumaraha Asampurna Viryatvat Prayashaha Ashodasha Varshat. So this particular important definition is given by Charaka, but this is a definition of Bala, not Bala Chikisa. This is a definition of Bala. Whereas if you go for Kashyapa, he has given a good definition. Devanam yoham havyapaha. Anena hi chikisite, anena hi samvardite itare chikisyante. So this definition is given by him. And Sushruta given a very beautiful definition, that is Tatra Kaumarbhrityam nama Kumarabaranam Datri Kshira Dosha Samshodhanartham Dushtasthanya Grahas Samuthanancha Vyadinam Upashamanarthancha. Similarly, Harita is also given a beautiful definition. He says Garbhopakrama Vijnanam Sutikopakramam Sataha Balanam Rogashamani Kriya Bala Chikisitam. Okay, so likewise the different definitions are given that we have already seen in one of the previous class. Now, one more important aspect which is included in Kaumarbhritya is Grahas, Graha Rogas. Okay, so actually Graha Rogas constitute the maximum portion of Kaumarbhritya syllabus. So for all practical purpose, again I will take a separate class for that. For all practical purpose, we compare Grahas with the infectious disorders, and how and what are the references supporting that particular view, that we'll discuss later. So Graha Rogas are also one of the important. Now the thing is, the Grahas which are mentioned in the context of Unmada and Apasmara, and Grahas which are mentioned in the context of Kaumarbhritya, they are actually different. Okay, so they are actually different. So Grahas which are mentioned in the context of Unmada and Apasmara, like Pitra Graha, Deva Graha, Gandharva Graha, where we find more subjective symptoms with less objective symptoms, and it is more likely to be behavioral and personality changes of a person. Whereas Grahas which are mentioned, or Graha Rogas which are mentioned in the Kaumarbhritya, so there we find both physical changes, that means both objective and subjective changes are more dominant. And they have got definite etiology, they have got different morphology. The Grahas, different morphology is mentioned, etiology is mentioned, and causative factors, diagnostic features, everything is mentioned. Such type of detailed presentation is not mentioned in case of Graha or Graha Chikissa, which is mentioned in terms of Unmada and Apasmara. Anyway, that's one important thing. They are different. Now, what is the importance of Kaumarabhritya? Kaumarabhritya is very important because the physicians of Kaumarabhritya, so they will take the child care. They will responsible for bharana and poshana of the child. They look after the child. They prevent the child from different disorders, make him adolescent, and then give to the society. So once they treat the child and give it to the society, then only the other branches of the medicines will have the patients, or country will have the citizens. So to preparing a quality citizen for the country is the responsibility of Kaumarabhritya physician. So he carries such a great responsibility. That's a very important aspect of Kaumarbhritya. Kumara Bharanam is mentioned. Bharana means Dharanam and Poshanancha. Dharana refers to holding. That means it is all the subject related to growth and development of the child, and Poshana refers to nutritional aspect of the child. Now, why it is compared to Agni Devata? That's also clear. Agni Devata is very important among the Devatas because he is the one who carries all the offerings given from the human beings and the priest and all to the other Devatas. Okay, he is acting as a mediator because we are giving all the offerings to the Agni in the Homakunda. So, what we believe is Agni will take these offerings and he will give it to the other Devatas. So therefore, he is working as a mediator. Similarly, Kaumarbhritya science is also a mediator between the child and the adults. Okay, so that means, therefore, Kaumarbhritya physician, if he treats the child well and make him adult, then only the other branches of the medicines will have the patients, and also country will have the citizens. Moreover, Kaumarbhritya plays a very important role in the healthy citizens for this country. Okay, so preparation or creation of a healthy citizen is also one of the big responsibility of Kaumarbhritya. Because it is a childhood period where we have to teach everything to the child. Okay, it may be good samskaras, good qualities, or good education, good health, everything. So these are all the subject matter of Kaumarbhritya, and therefore a physician of Kaumarbhritya carries a lot of responsibility, and therefore the science is also very, very important. This branch is also very important. Now, greatness of Kaumarbhritya physician, that is very difficult for him to take care of the children. The reason given by Kashyapa is, he very clearly says, Kashyapa, one of the beautiful quotation, Bishak Kaumarbhrityaste karane nitya dukkhite. That means he says that a physician of Kaumarbhritya will be always under stress. He has to work under stress, and his work is very challenging. The reason why he give for this is, in childhood period and newborn or infantile period, what actually happens is the three doshas are not actually completely developed. Tridoshir binaha. Vina tridoshir. Okay. So that means they are not completely developed. When three doshas are not completely developed, it is very difficult to assess the, suppose I take Vata, Vriddhi, Vata, Kshaya, Vata, Prakopa. This assessment will be very difficult when Vata itself is not completely formed. It is immature. Okay, so what are all the standards which is given for the identification of Vriddhi, Kshaya and Prakopa? So that is very difficult in case of children, as these doshas are not formed completely, and even the homeostasis of the body of the child is also not complete in comparison to adults. That's the one thing. Second is, a newborn or infant is not able to express the suffering. Okay, so it will have minimum symptoms. It will have paucity of the symptoms, and it will have only few symptoms. By considering these few symptoms only, you have to understand the inner suffering of the child. It is not able to express the feeling, actual suffering. Third important thing is, not even the proper signs and symptoms will be manifested. Okay, so chesta ingiter vinaha. That means even child is not able to express a thing by body language. Of course, it can do some of the body movements by touching the area of the pain and all. But actually, by body language also it is not able to tell. And even the signs will also not develop properly. Symptoms will also not develop properly. But in spite of that, what society expects, na parugnat, that means what society and what parents expect is, pediatrician or a Kaumarbhritya physician should not commit any mistake in spite of all these limitations. Child is not expressing all the symptoms. Okay, there is no complete development of the signs and symptoms. There is no body language expression. Okay, even Vata, the doshas, their status is also not clear. In spite of that, when child is having some problem, what parents and society expect is pediatrician, child Kaumarabhritya physician should perform his function, duty very up to the mark, very perfectly, and without committing any mistake. If he commit mistake, so they will not accept it. Okay, because it's a matter of emotion for them. Child is not a simple matter for the parents. Almost the child is a matter of emotion, feeling for them. So they are ready to do anything for the child. So many times we can say parents are praying, why God has given this suffering to my children? He would have been given to me. So this is the emotion and attachment they have got there with the kid. So if you commit any mistakes, so they will definitely not forgive you. So therefore, he says a Kaumarabhritya physician has to do the work under all these limitations. Therefore, Bishak Kaumarabhritya ste karanir nitya dukkitaha. Therefore, he will always under stress. Because another thing is, he says, Kashyapa says that there are three important persons in this world, so who perform their duties under great stress. That means they have to take care of two persons at a time. Okay, two persons at a time. So that is one is that is Bala, Dhatri, and Garbhini. So they will have to take care two persons at a time. Garbhini has to take care of herself and as well as her kid also. Then Dhatri about herself and her kid also. Now, physician of Kaumarabhritya also have to look at two persons at a time. For example, antenatal period is also therefore Haritha says, antenatal period is also very important for a Kaumarabhritya physician, because the fetus is growing inside and future of the fetus depends on the antenatal period. So now he has to take care of both what you say, the antenatal lady and as well as the fetus. Okay, and the child he has to take care anywhere, but after birth also he has to take care of Sutika Stri and as well as the child, because Sutika Stri is very important because she is the source of feeding. So many disorders will come through the stanya. Okay, therefore he is always doing his work under great stress. Okay, now there are two important chapters in Kaumarbhritya, especially Kashyap Samhita. So one is Vedanadhyaya and another one is Lakshanadhyaya. These are the two unique chapters which is present in Kashyap Samhita. Okay, and this is a real contribution to Kaumarbhritya. Vedanadhyaya is a list of symptoms of a baby which is not able to express the feeling through words. Okay, so just by observation you have to observe all the findings and then you have to come to a conclusion. Lakshanadhyaya is nothing but examination of the baby. Okay, different physical examination of the baby, and also Lakshanadhyaya is a beautiful chapter. It's a mixture of physical examination. It's a mixture of some astrological calculations also. So they are also predicting the future of the baby there, and that's a very interesting chapter. Okay, that is also present in Kaumarbhritya. That is also a big contribution of Kaumarbhritya. Okay, now. Another important aspect which is mentioned in Kashyapa about the Kaumarbhritya is he is almost all the first person who included Garbha under the age group. He says Garbha, Bala, Kumarakyam, Ityetam Trividam Vaya. Okay, so none of the other authors included Garbha under the age group. So according to them, age groups are from Bala, Madhyama, Vruddha, etc. But Kashyapa is not like that. So he says that the age group starts from the fetal life itself, because he knows the importance of fetal life, fetal events. Okay, so when the baby is born, it is almost 9 months old. Baby is not 1 day old. Okay, so baby is 9 months old. So we have to keep this point in mind. Therefore, Kashyapa says that Garbha, Bala, Kumarakya, Ityetam Trividam Vaya. 3 types of age classification is there: Garbha, Bala, and Kumara. That's in the childhood period. Okay. Now limitations of Bala. We know that Tatra Balam Nama. Bala is that stage actually. Balena Hinam, we can say Balena Hinam. That means there is some limitation of Bala. Okay, that means structural and functional development of the child is not up to the mark. Of course, there are formation of the structures, but they are not completely formed. And the functional aspect, functional integrity is not complete. It has to take the time. It will take time. It will take some time for the complete maturation. So because of the immaturity of the organ system and immaturity of the system of the body, so what actually happens is there are so many physiological presentations which looks pathological to the parents. Okay, therefore they will come. And so you should know that these are all the physiological things which is happening in the baby because of structural and functional immaturity. Okay, another one is we know that Kashyap is an authentic person of Kaumarabhritya. Okay, so he is a very authentic person for the Kaumarabhritya. There are totally 200 chapters are there in Kashyap Samhita. So many of the chapters are unfortunately missing. We will have a detailed discussion on the same later. Okay, so presently some 76 chapters are available. That the available chapters are also not complete. Okay, about 9 to 10 chapters which are explained exclusively for Kaumarbhritya, like Vedanadhyaya, then Dantodbedi Adhyaya, Lakshanadhyaya, Jati Sutriyadhyaya, etc. Okay, and therefore now some of the important factors which is mentioned in Kashyap Samhita with reference to Kaumarbhritya is so timing of locomotor milestone achievement is mentioned by Kashyapa. Kashyapa says that tatra samvatsarat upatishtati vachan cha prasrujati. That means he says the right age for standing and walking, developmental milestone. Okay, first time baby walk few steps. So that should be attained by 1 year, 12 months. Okay, and also vachancha prasrujati. So bisyllables like mama, papa, dada. So these words will going to start uttering these words by the end of 1 year, and that's the maximum time. It has to be started by this time. It's the maximum limit. Of course, it may start initially also, before this also. There's no issue because monosyllable words the child start by 6 to 7 months only. Bisyllables usually start by 9 months. And he says that by 12 months, this should be there. Vachancha prasrujati. Okay. And similarly, locomotor movements of the developmental milestones of the baby start from the sitting with the support, sitting without support, standing with support, standing without support, and then walking few steps independently. So these are the locomotor steps. Whatever may be the case, but by the end of 12 months, 1 year, so baby has to put few independent steps. And that's the main thing. Okay. Now there is one more important thing which is mentioned by Kashyapa, so very beautifully explained. That is the assessment of the higher mental function. Higher mental function and cognitive growth, that has been mentioned. So he explains a beautiful shloka for that. Yata swaram tata saram. So yata vrutam tata vruttam. Yata chakshur tato manoho. Stomanaha. Yata swaram tata saro. Yato rupa tato guna. So actually this is assessment of higher mental growth of the child. Okay. So similarly in the Lakshana Adhyaya, we will say, as I already explained, it's a combination of astrology and physical characters of the body are used to assess the mental build-up of the body. See, it's very interesting. In Lakshana Adhyaya, they say some of the physical examination, and they will find some of the physical examination point. By looking at that physical examination point, they will assess the mental growth or mental capacity of the child. By looking at the mental capacity of the child, they will assess the future prediction. They will also predict the future life of the baby. It's very interesting. Okay. So now, introduction of certain brain tonics. In the beginning itself, Kaumarabhritya says that certain brain tonics has to be introduced to the child in the beginning itself, because they know that in the first 2 years of the life, the brain grows very, very fast. Okay. And that has to be managed very well. So to produce a high quality of the neuron, so that cognition power of the child may be increased to higher extent. So they introduce certain medhya drugs, including Swarna Prashna and Grita, Swarna, Vacha, etc. Grita is medhya, as we know. Now, again, Ayurveda, Kaumarabhritya very highly appreciate the role of parental care in the development of the child. Again, the role of sympathy, affection, care, security, etc. in the development of the child. So actually this concept is explained in the context of Dhatri Chikitsa. What there says, Asha, Dharma, Kripa, Sneha. So Dhatri will impart these 4 symptoms or these 4 characters to the child, they say. So that means Dhatri means it's also referring to mother also, one who feeds the baby. Okay. So what is the role of mother here? Mother is the one who gives these 4 important aspects to the child. What is that? Asha, Dharma, Kripa, Sneha. Asha means hope, motivation or hope. Okay. Bringing the confidence in the child. Okay. Dharma, that is teaching the cultural morality, okay, cultural ethics and as well as morality, okay. Asha dharma kripa means giving security to the child. Asha dharma kripa sneha means again love, sympathy, etc. Love, sympathy, affection, etc. So these four will be given by the mother to the child, okay. So therefore this is thus Kaumarabhritya explains the importance of parental care in the proper growth and development of the child, okay. Now the method of administration of the drugs in the children, that is a very important aspect. This is how this science, this branch will going to differ from the other branches, because administration of the medicine is quite difficult in children, and dose of the children is also calculated very precisely. And again, all the drugs and all the procedures you cannot employ in the children because of functional and structural immaturity, okay. So now, to have a very good health of the child, especially the newborn and infant, it is very important to have a healthy mother, because mother, if she is healthy, she is producing a very healthy breast milk, and that breast milk will be consumed by the baby and it will grow normally. Suppose mother is producing a vata prakopita, pitta or kapha prakopita breast milk, okay, or ashta doshas, as explained by Charaka explained ashta kshira doshas, producing such type of kshira, that will have adverse effects over the child also, okay. So therefore that's one important thing. And again, the Ayurveda says that medicine can be also given orally, but it is quite difficult. So at times you can also apply the medicine over the breast of the mother, and later it can be, baby is allowed to suck the breast milk, so that medicine will go inside. This concept is also mentioned. Another concept is you apply the medicine over the breast area and allow it for 1 mahurta, some 48 minutes, etc. Let it dry, and by that time it will be absorbed inside and go into the breast milk, and then baby is allowed to take the breast milk. This concept is also explained, okay. Now concept of dosage schedule is very important, and it has been also mentioned according to, because matrathu alpatara mataha, okay, dosha dusha malashaiva mahatam vyadayashe. What Charaka says is dosha dusha and vyadi etc. is similar in children and as well as adults. The only difference is matra to alpatara mata, okay. The dose is less. It is not only the dose, that means matra is not only refers to the medicine, and all the dose, that is matra of the doshas, matra of the dhatus, everything is less in children. That is structural and functional immaturity of the child is highlighted by Charaka. Again, he says that continuous medication should not be given to the children. Na una dvadasha varshanam na ekantena prayodiyate. That means medicine should not be given continuously in the children below 12 years. Okay, if any medicine, if it is given continuously below 12 years, it will go into destroy the bala, oja, etc. and cause many problems. Okay, then again, the childhood period is classified into Kshirapa, Kshiranada and another period. The first year is called Kshirada, 1 to 2 years is called Kshiranada, and after 2 years it is called as Annada. Now, thing is, Agni in the children is very variable. Again, Kashyapa very clearly says, Anavasthita Agni, that means especially in the Kshiranada period, Agni is very, very unstable. Okay, so Kshiranada 1 to 2 years, that's the time actually baby is growing well, and that time child is having Anavasthita Agni, that means unstable Agni. Okay, so therefore that time has to be managed very precautiously and also with all the care, and that's very clearly told. Okay, even we find such problems of mera bachcha khai nahi raha hai, kuch bhi nahi khata hai, ye hai, wo hai. These complaints are quite common in 1 to 2 years because instability of the Agni. So this point is also very well mentioned by Kashyapa. Then there is also mentioning of play and playing articles, etc. That is explained. And then play articles, role of play, Krida Bhumi, Kridanaka. This is explained. Then again, Charaka also explains one important factor in Kaumarabhritya, that is how to take care of the psychology of the child. So you should not frighten the baby, and you should not beat the baby, and you should not affright the baby when he is not taking the food by calling some bhuta, preta, etc. Okay, so these things are very well mentioned. This suggests that how much care that I have taken to protect the psychology of the child. So these are some of the basic ideas of Kaumarabhritya. So I have gone through only the superficial part. Apart from that, there is some of the very special disorders only exclusive to Kaumarbhritya. For example, Ashtakshira doshas are very exclusive. Then we have got Stanya, Dushta Stanya Janita Vyadhis are there, starting from Kukunaka, then Visarpa, everything. Then some of the nutrition disorders are mentioned in terms of Fakkaroga. Okay. Then Balashosha, Parigarbhika. Okay. Then Utpullika is one more disease mentioned by Yoga Ratnakara. Then we have got Ulbak Roga. So likewise, many exclusive disorders are also explained in Kaumarbhritya. So this is an overall view of a Kaumarbhritya. So with this we conclude. We will meet again in another class. Thank you very much. Don't forget to subscribe my channel and also give the comments. Thank you very much.